Introducing our group members, Nafisah binti Yusuf, me, Nur Asma binti Rashid, Nur Ulfa binti Muhammad, Nur Fariha Alia binti Adnan, and Muhammad Zuhairi bin Ainul Adnan. Before we go further, let us see the overview of Royal Adelaide Hospital. Royal Adelaide Hospital is South Australia's flagship hospital, providing a comprehensive range of the most complex clinical care to an estimated 85,000 inpatients and 400,000 outpatients each year. There are 5 main elements that are highlighted in Royal Adelaide Hospital, including first, planned, designed and built around the needs of patients. Second, leading the way with clinical technology. Third, providing a full range of complex clinical care. Fourth, equipped to respond to major disaster. And 5 is green and sustainable design.
We will start our analysis of facility planning with the advantages of Royal Adelaide Hospital. The first one is RAH serves as a VT teaching hospital offering a unique environment for medical education. Affiliated with medical schools, it provides hands-on training for medical students, residents and fellows. This collaborative approach ensures a continuous exchange of knowledge and expertise. Second one is RAH houses specialized units in dermatology, spinal care, cardiology and many more. This unit functions as centers of excellence, bringing together a diverse array of medical specialists. Patients benefit from comprehensive and multidisciplinary care. The third one is RAH prioritizes a healing environment by incorporating nature and outdoor spaces. Therapeutic gardens contribute significantly to the well-being of patients, aligning with research that supports the positive impact of nature on health outcomes. Next, innovative measures such as self-service kiosks demonstrate RAH's commitment to minimizing physical contact. These kiosks empower patients to manage administrative tasks independently, enhancing efficiency and safety. The last one is the hospital's design is meticulously planned to be patient-centered, from stress-minimizing entrances to patient rooms maximizing natural light. Every aspect is tailored to support a positive healthcare experience. The next is, we will go through the suggestion for the limitation that we found. The first one, we recommend exploring collaborative partnerships with nearby specialized hospitals to address the absence of maternity and pediatric departments. This strategic collaboration would ensure seamless care and efficient resource utilization. Next is, to enhance the navigation within the hospital, we suggest implementing clear wayfinding strategies, including color-coded zones and advanced signage. This will create a more intuitive and user-friendly hospital environment. The next one is, our suggestion is to diversify cafeteria facilities and explore partnership with external vendors to enhance dining options. This approach will cater to diverse dietary preferences, promoting overall well-being for patients and visitors. The next one is, considering the challenge of limited parking, our recommendation is to explore comprehensive transportation strategies. These may include the introduction of shuttle services and sustainable transportation options to ensure accessibility and convenience. Next, I will present some part of our analysis by department. The first one is Emergency Department. RAH central location in Adelaide ensures easy access for the city's population through various transportation methods. The ED is strategically positioned and located close to critical services, guaranteeing comprehensive care when needed. As a major hospital, RAH's ED is designed to handle a high volume of patients, accommodating various medical conditions and acuity level. Within the ED, specialized areas cater to specific needs, including trauma, resuscitation, and isolation for contagious diseases. RAH's ED also be built with patient-focused waiting areas to provide comfort and a triage system for prioritized care, ensuring efficient service based on severity. Next is Outpatient Department. Level 3 outpatient clinics at RAH feature advanced equipment for comprehensive specialized care. This centralized hub on Level 3 provides specialized medical services, diagnostics, and consultation in a patient-friendly environment. Strategically, on the third floor, it provides easy access to the patient as it is located near the main entrance. The third one is ICU. RAH Advanced Care Unit boasts top-notch medical equipment for advanced care. It is a highly technical space with advanced monitoring systems ensuring precision in patient care. Designed with large windows, the unit prioritizes natural light, fostering a comforting atmosphere for patients. Located next to gardens, it creates a healing environment offering solace to patients and respite to loved ones. Strategically co-located, the unit provides immediate access to critical services in emergencies, enhancing patient outcomes. For diagnostic imaging, there are 3 locations in RAH, located at level 2, 3, and 5. Emergency imaging on level 2, near the emergency department, is strategically placed to minimize transition time. This quick access is crucial during emergencies. Level 3 is where the imaging facilities shine with cutting-edge technology. It is the core of RAH Diagnostic Services, offering advanced capabilities for precise and timely medical imaging. Imaging on level 5 ensures easy access for patients before or after surgery. It streamlines transitions between different machines, making the imaging process smooth. Next, the radiotherapy departments. Proximity to the acute assessment unit ensures swift and efficient access to radiation therapy. Timely initiation is crucial for optimal outcomes, particularly for patients with critical medical conditions. Patients undergoing radiotherapy often face serious conditions. By reducing the distance and travel time between the AAU and the radiotherapy department, RAH aims to minimize stress and discomfort for patients, promoting a patient-centric care approach. The Cancer Day Center, positioned above the radiotherapy department, provides convenient access for patients and minimizes travel for staff. This strategic co-location enhances the overall efficiency of cancer care services at RAH. Last but not least, pharmacy. The first floor pharmacy at RAH features cutting-edge technology ensuring top-notch pharmaceutical services for diverse patients' needs. It serves as a central hub for medication services, dispensing prescriptions, managing inventory, and leveraging technology for efficient pharmaceutical care, supporting overall patient well-being. Strategically placed on the first floor, the pharmacy optimizes patient access, emphasizing its crucial role at the forefront of healthcare services within RAH.
Next, we move to the evaluation of medical equipment integration in Royal Adelaide Hospital or RAH. The Royal Adelaide Hospital's integration of medical devices is a prime example of the hospital's all-encompassing dedication to use the latest technology to improve all aspects of patient care. RAH has strategically used technologies to streamline workflows in an effort to maximize staff efficiency, improve patient care, and optimize workflow. First, patient care and safety. At Royal Adelaide Hospital, the real-time data interchange facilitated by wireless networking stands out as a key benefit. This connectivity not only improves the speed and accuracy of diagnostics and treatments, but also empowers our healthcare teams with rapid access to vital information. Through timely intervention and personalized treatment plans, we can swiftly identify and manage deviation from normal parameters, ultimately enhancing patient outcomes and reducing the probability of unfavorable events. Second, enhanced collaboration. The Royal Adelaide Hospital's commitment to enhanced collaboration is evident through the real-time accessibility of patient data across departments. This has proven crucial in fostering better cooperation and communication among the medical practitioners. Embracing a patient-centric approach to therapy, this interconnection seamlessly integrates various aspects of a patient's healthcare experience. Consequently, their healthcare professionals can make more informed and sensible decisions with a comprehensive understanding of each patient's medical history and present condition. Third, workflow optimization. A situation change in clinical workflows has been achieved at RAH through the integration of medical devices. The impact on staff experiences is profound, creating an environment where professionals can thrive in their roles. By eliminating manual data entry and unnecessary documentation, their seamless connectivity between medical devices and electronic health records allows medical professionals to focus on providing direct patient care and collaborating with multidisciplinary teams, leading to increased productivity and employee satisfaction. Fourth, research and quality enhancement. Royal Adelaide Hospital's integration of medical equipment not only improves patient care but also promotes a culture of continuous research and quality enhancement. The massive quantities of data produced by these connected devices are a crucial asset for comprehensive examination. Their research and quality improvement teams leverage this data to improve clinical procedures, maximize best practices, and contribute insights to the larger scientific community. RAH is positioned as a vibrant center of innovation in healthcare practices, thanks to the insight gained from integrated medical equipment. Lastly, cybersecurity measures. In an era of interconnected healthcare technologies, RAH places a paramount focus on cybersecurity within its integrated medical device ecosystem. They recognize the critical need to protect patient data and have adopted strict cybersecurity policies. Complying with the highest privacy and data security laws, their digital infrastructure is resistant to cyber attacks. They continuously improve their cybersecurity procedures to stay ahead of potential threats and uphold the highest standards of patient data protection in this rapidly evolving field of healthcare technology.
Next, let us move to assessment of information technology infrastructure in Royal Adelaide Hospital. The first key component is network infrastructure. The hospital information technology infrastructure boasts technological complexity and modern architectural design. Notably, features include recycled steel, low emission glass, autonomous guided vehicle, and BIM, building information modeling. BIM enhances visualization, communication, resolve clashes, optimize design, and increase energy efficiency. The second one is data privacy and security. Patient data protection is a top priority at the Royal Adelaide Hospital. Stringent adherence to health information privacy regulation is ensured. Robust measures include encryption protocol, precise access control, and regular security audit to address vulnerabilities promptly. The third one is electronic health record EHR system. The EHR enables real-time monitoring and analysis for personalized and proactive care. It supports remote consultation and telemedicine, particularly beneficial for remote or rural patients. Patient engagement is emphasized with a secure online portal for access to medical record, prompting transparency and collaboration. And the last one is disaster recovery and business continuity. The Royal Adelaide Hospital takes a comprehensive approach to disaster recovery and business continuity. Carefully developed plan and backup system are regularly evaluated and tested for effectiveness. The hospital's commitment to maintaining high standard in patient care and safety is evident, even in challenging circumstances. In conclusion, the Royal Adelaide Hospital innovation approach to healthcare extend to its network infrastructure, data security, EHR system, and disaster recovery. The hospital's commitment to excellence, patient-centric care, and adaptability to evolving healthcare needs set it apart as a leader in the industry. Next, let us move to the integration of medical system and technology in Royal Adelaide Hospital. The first one is cutting-edge medical imaging. The Royal Adelaide Hospital stands out for its excellence in medical imaging technology. The hospital integrates a spectrum of advanced imaging modalities including radiography, MRI, nuclear medicine, ultrasound, elastography, photoacoustic imaging, and tomography. The state-of-the-art diagnostic capabilities ensure accurate and comprehensive imaging for improved patient outcomes. The second one is Picture Archive and Communication System (PACS). Within the hospital, the PACS is streamlined to efficiently store and retrieve medical images. Serving as a central platform, PACS optimizes access to critical diagnostic information. This is not only enhance the workflow of healthcare worker but also facilitate faster decision making in patient care. The third one is Laboratory Information System (LIS). The LIS play an important role in managing test orders, result and specimen tracking. Its efficient coordination of testing processes contributes to timely and accurate diagnostic results. Additionally, there is potential for LIS integration with research center, fostering streamlined collaboration and advanced and evidence-based diagnostic services. The fourth one is Clinical Decision Support System (CDSS). The hospital has introduced an advanced clinical decision support system for informed, evidence-based decision making. This system utilizes patient data, best practice, and the latest medical research to enhance decision making capabilities. The implementation of CDSS aligns with the hospital commitment to providing cutting-edge medical knowledge and technology. The fifth one is telemedicine and remote monitoring. The Royal Adelaide Hospital showcased a robust integration of telemedicine for virtual visits and remote monitoring solution. This approach improves patient access, supporting the efficient utilization of medical resource. Real-time tracking of vital signs through telemedicine promote proactive and personalized patient care. And the next one is Advanced Pharmacy Information System. The hospital strategically integrates Advanced Pharmacy Information System for efficient, patient-centered medication management and expensive pharmacy on the first floor, coupled with innovation amenities like drive-through service, enhanced patient convenience. Emphasis on patient safety is ensured through real-time information on prescribing, dispensing, and monitoring. And the last one is Comprehensive Training and Support System. The Royal Adelaide Hospital is committed to providing its medical staff with the skill necessary for the effective use of modern technology. Proximity to research center and internal education facilities ensure a continuous learning environment. A dedicated support system is in place to promptly resolve technically issues, minimizing disruption to patient care.
Next is patient flow analysis. Patient flow analysis is crucial for several reasons in healthcare facility planning and management. For example, it optimizes resource allocation. By understanding how patients move through a healthcare facility, administrators can allocate resources more efficiently. This includes staffing levels, equipment availability, and the utilization of different departments to meet the demands of patient care. Furthermore, patient flow analysis also can help reduce waiting times. Analyzing patient flow helps identify bottlenecks and areas where waiting times may be prolonged. By addressing this issue, healthcare facilities can enhance patient satisfaction, improve the overall experience, and reduce the risk of adverse events. Next, patient flow analysis also improves staff productivity. By understanding patient flow analysis, it allows healthcare administrators to optimize staffing levels and workflow. And also, lastly, patient flow analysis is important in meeting regulatory standards. Healthcare facilities are often subject to regulatory standards regarding patient care and safety. So, patient flow analysis helps ensure compliance with these standards by identifying areas that may need adjustment to meet or exceed regulatory requirements. So, we have done a patient flow analysis on several departments in the hospital. So the first department is emergency department. For example, a patient with a severe chest pain. First, the ambulance will drop the patient at the emergency entrance at level 2. Then the patient will be bring into the triage at ED. At the same time, the patient information will be registered by the guardian or anyone beside him. Next, the medical assistant will initiate a rapid assessment to the patient to identify the condition or the classification of the patient. Next, if the patient is critical, then they may be transferred to another department or anything. And if stable, they will enter AAV for the next 72 hours and will be monitored. And lastly, they will be discharged and go to 3D for paying the bills. Next is the intensive care unit or the ICU. Let's say if the patient is transferred from another hospital to be admitted at the ICU, first the patient will be arrived at the hospital by ambulance at emergency entrance level 2. Then the patient will be bring into the triage at ED. And there, the medical staff will initiate emergency interventions and undergo several assessments. After that, the patient will be admitted to the ICU level 4 through the lift. And next, the patient will be employed with advanced monitoring equipment and conduct a true assessment. Next, the specialized medical teams will initiate a specific intervention, medications, and therapies based on the underlying cause and symptoms. And next, continuous monitoring by ICU team and other specialists. Then depend on the patient's condition and respond to the treatment. If the patient is stable, then they will be discharged. Or if the patient is still unstable, then they will go back to continuous monitoring. Next, for the orthopedic department, first the patient will arrive at the hospital through a car, so they will park their car on the car park on the level 2. So after they park their car, they will go to level 3 for the registration, and then after that they will go to the medical imaging for assessment on their previous diagnostic, and then the patient will meet with an orthopedic specialist for a comprehensive consultation. There, the specialist will review all the patient's medical history and the diagnostic tests such as X-ray or MRI that they have done before, and then the result will be examined. And after that, if they need to go for, let's say they need a drug, so they will go to the pharmacy before they go home. Next is medical imaging department. So same like previous case, the patients that schedule for an appointment with the diagnostic medical imaging department may be arranged based on the type of imaging required with the urgency of the diagnostic needs. Upon arrival, so the patient will register on the lobby at level 3 and then will be instructed to go to the outpatient clinic at the same level for the pre-assessment and consultation. Next, the patient will be assigned to wait in the medical imaging department before their imaging procedure. And then the patient will undergo necessary diagnostics such as X-ray and others if needed. Next, based on the imaging interpretation, the radiologist will evaluate and discuss with the patient for further treatment such as admission or rehabilitation department if necessary. So before they go home, they need to go to the pharmacy to take their drugs. Next, for the outpatient clinic, first like previous cases, so they will park their car on the car park and then go straight to the level 3 at the registration lobby. Then they will register themselves and then go to the outpatient clinic and wait for their name to be called. After that, they will meet the specialist for their consultation. And next, they will go for treatment if needed, and then go to the pharmacy to take their prescription and then go back to car park and go home. And lastly, for the oncology department case, the patient will park their car on the car park and then go to the level 3 for the registration. After that, they will be instructed to go to the oncology department at level 7. There, the specialist will consult with them based on their appointment. If let's say they will go for chemotherapy session, they will do the chemotherapy session there for several hours. and then after that they can go home. Let's say if they need a prescription, they will go to the pharmacy at level 2 to take their drugs, and then they can go home.
For safety and regulatory consideration, there are 7 aspects that we would like to mention. The first one is accreditation. Hospitals usually go through accreditation procedures to make sure that they adhere to strict quality and safety requirements. In Australia, groups like the Australian Council on Healthcare Standards (ACHS) may handle accreditation. Second, clinical governance. Hospitals use clinical governance system to uphold and enhance the standard of patient care. These cover risk management, ongoing improvement, and clinical performance monitoring. Third, occupational health and safety (OHS). In order to ensure a secure working environment for employees, patients, and visitors, hospitals are required to comply with occupational health and safety requirements. These include taking precautions against mishaps, harm, and exposure to dangerous materials. The next one is infection control. To stop illnesses from spreading in healthcare setting, strict infection control procedures are essential. Hospitals adhere to policies and procedures in order to keep a hygienic and secure setting. Next, Royal Adelaide Hospital also prioritizes about patient privacy and confidentiality. Respecting patient privacy and maintaining confidentiality requires adherence to rules such as South Australia's Health Records Act. And then, medical device and equipment standards. To ensure the safety and efficacy of medical equipment and gadgets, hospitals must make sure that everything complies with applicable standards. And lastly is emergency preparedness. Hospitals already have specific plans in place for emergencies, including natural disasters, accidents, and public health crises.
For a conclusion, the Royal Adelaide Hospital RAH has effectively led the way in healthcare innovation by incorporating state-of-the-art medical technologies. Wireless networking has made it possible for medical devices to communicate seamlessly, which has significantly improved patient care, operational effectiveness, and interdisciplinary collaboration. Rapid access to vital information has been made possible via real-time data transmission, which has encouraged prompt interventions and individualized treatment programs. In addition to improving clinical operations, removing the need for manual data entry, and enhancing worker experience, this networked system has strengthened a continuous learning culture. So, for the recommendation, in the future, RAH should continue to be dedicated to patient safety, legal compliance, and continuous improvements in medical technology and process. Analysis for patient flow, layout, and others should be done as scheduled to enhance and improve the hospital's quality and reliability. Its position at the vanguard of healthcare innovation will be further cemented by emphasizing ongoing education and engagement with research centers. RAH is able to contribute to the expanding body of medical knowledge and expertise with maintaining its high standard of patient-centered care by using its integrated medical system and technology.